Hello everyone, this is Mary RDH and welcome back to my channel, Dental Disasters. Now, the story I have tonight is one of the most horrifying I think I've ever researched, and it's honestly unimaginable that anything like this could ever happen to someone. But this is the story of Ralph Chapman, a 75-year-old man who went in to see the periodontist. And if you don't know what a periodontist is, it's a dentist that specializes in treating gum disease. He went in to have a routine dental surgery done, a laser surgery, and unfortunately, it cost him his life.
His name was Ralph Chapman. His wife also filed a lawsuit against Richmond, who was working with a different dentist. Her lawsuit claims during a laser surgery, Chapman's mouth caught on fire because of an unsafe amount of oxygen, as the dentist fired the laser when it was unsafe to do so.
Yes, guys, you heard that right. Fire. I mean, I cannot even wrap my head around that. In 20 years, over 20 years of being in dentistry, I have never heard of a case where a patient's mouth caught fire. This scenario is truly something of nightmares, and the fact that it happened in a dental setting and an appointment which is pretty routine. It looks like Ralph was getting periodontal laser gum surgery. It's a surgery that's often recommended for those who are suffering from gum disease. And as a reminder, guys, keep in mind that you can avoid gum disease with good flossing, using your water pick, good brushing. Sometimes there is a genetic component to it, which will make it to where you are predisposed to having gum disease. So it's not always necessarily that you're doing a terrible job with your home care. Sometimes genetics can work against you. That being said, either way, he was getting a routine laser gum treatment to help mitigate his gum disease, and this is what happened. Ralph Chapman was a 75-year-old Scottsdale, Arizona resident, and on August 28th, 2020, he went to AZ Perio, a periodontal practice located in Scottsdale, Arizona. Now, periodontists are dentists that specialize in treating gum disease only. They also place dental implants. The plan was to have a routine gum surgery, and I'm sure he never imagined that he wouldn't make it home. The plan was to go ahead and use IV sedation along with supplemental oxygen to make sure that all was well during the procedure. The team working on Ralph that day included the periodontist, Bruce Hauser, as well as the CRNA, whom provided the anesthesia as well as the oxygen, Tony Richmond. Now, oftentimes during these type of surgeries, oral surgery, perio surgery, etc., it is common to put in what's called a throat pack, which is essentially like a woven 2 by 2 gauze that is placed in the pharynx. And the purpose of that is to hopefully keep any debris from the surgery, any foreign bodies essentially, from getting into the throat. Now, at some point during this surgery, something went wrong and that throat pack actually caught fire. Now, I was unable to find any notes regarding what the dentist and the CRNA did immediately following the fire in order to render aid to the patient, but I do know eventually they had to call the ambulance and Ralph was transported to the Arizona Burn Center and Valleywise Medical Center. He was there for a while, but unfortunately, on September 9th, 2020, Ralph did succumb to his injuries. Ralph's cause of death was officially reported to be caused from complications arising from injuries sustained from thermal inhalation. A wrongful death lawsuit was filed by Ralph's widow in May of 2021. The suit involved the dentist, Bruce Hauser, as well as the anesthetist, Tori Richmond, and his employer, Lifeguard Anesthesia. Now, it's important to note that both were cleared from their respective boards of any wrongdoing, that is. So the dentist was cleared by the Arizona Board of Dentistry in any wrongdoing, and the anesthetist was cleared from Arizona's Board of Nursing from any wrongdoing. That being said, the suit alleges that the dentist practiced an error and that he utilized the laser at an inappropriate time. And the suit alleges that the anesthetist practiced an error and that he utilized oxygen levels that were inappropriate and therefore made the likelihood of fire more probable. Now, of course, that's going to have to play out in court. But all I can say is, of course, no amount of money is going to heal the hurt that the family sustained. And it's a really, really tough thing to think. I can't imagine what the family must be going through. So all I'll say is make sure you keep that family in your thoughts and prayers. In a story this bizarre, it's hard to say what could have been done differently to not have such a horrible outcome. But what I will say is this, is whenever you are looking for a prospective dentist, especially if you plan on having oral surgery done or anything that's going to require general anesthesia especially, go ahead and go to your State Board of Dentistry website. When you go there, you can put in the name of the prospective dentist, and it's going to tell you A, if they're still licensed, but B, if they have any infractions, and also whether or not their facility is even licensed to provide general anesthesia. Not all offices are able to do that. You do have to get special licensure to be able to provide general anesthesia in your office. So definitely go check that out. Well, thanks for sticking around, guys, and listening. And make sure you go ahead and subscribe. I will be posting videos each and every week of dental disasters.
Never wanna leave you in the dark. Never gonna leave until I say, yeah, I got you.